قلبه وقف حوالي 8 ل 8 دقائق ونص. في 17 جولاي مساء بلشت أحس في أوجاع بالإيد اليمين. اتصلت طبعا مع بنتي الموجودة هون وقررنا إنه نروح على المستشفى الطوارئ. طبعا اختارت هي مستشفى Emirates هوسبيتال. لما وصلنا على الامرجنسي صار في عندي ميجر هارت اتاك. قلبه وقف حوالي 8 ل 8 دقائق ونص. طوارئ عملوا اللازم بسرعة ورجعوا تدفق الدم نوعا ما للقلب، ونفس الوقت بلشوا باتصال مع الدكاترة المختصين، دكتورة القلب من دكتور الأعصاب. ومؤكد عملية القسطرة صارت بنفس الليلة اللي اجيت فيها، وبلشت اني افيق يوم الجمعة. واللي فهمته انه القسطرة كانت ناجحة جدا، وبلشت اشوف شو العناية اللي عم باخذها من المستشفى. طبعا كانت عناية ممتازة من الدكاترة، دكتورة القلب، دكتور الأعصاب، والممرضين والممرضات. ولازم كمان انه نذكر الCCU اللي موجود فيها أجهزة متكاملة للعناية المركزة بالنسبة للناس اللي مثل حالتنا.
هلا أنا بدي أزيد بس على يعني اللي حكاه جوزي، إنه الإكسبيرينس تبعتنا بالCCU، وهو حتى لأنه نايم كان 4 أيام ما كانش حاسس شو عم بيصير، بس إحنا كنا كل الوقت مع الدكاترة، ما تركوا على طول، كانوا يجوا. وأحسن إشي الإكسبيرينس تبعت النيرسز اللي بالCCU، they are the best، المزبوط، they are so good، يعني ما عمرهم تركوا، و they were very friendly, very cooperative، يخبرونا what's going on. يعني it was the best experience in my personal opinion على الواحد اللي بيكون هالقد خايف وهالقد، لأنه كان وضعه very critical. والكير اللي أخده هوني I don't think إنه يعني like I've never seen it before. المزبوط.
Thank you to the hospital, the incredible nurses that made this environment as positive as it could be despite the situation. Thank you to the staff downstairs that made us coffees every day and tried to make us smile. The receptionists on this floor, the cleaning services that really helped us with this really challenging environment. My parents also celebrated their 40th anniversary in this hospital, and so the staff made it as enjoyable as it could be.
My name is Dr. Fatemeh Nabavizadeh. I'm consultant cardiologist and head of cardiology department at Emirates Hospital. At Emirates Hospital, our cardiology team and emergency team is ready 24/7 to take care of all the cardiac cases and to give a very good management plan for them. So I will talk about Mr. Omar, who was brought in a critical situation to our hospital. He was in cardiac arrest when he was brought by his daughter to emergency department. There, the team of emergency and cardiologists, they revived him. They gave him a cardioversion DC shock, and then immediately we intubated him. We started medication, the necessary medication to stabilize him. He had a very extensive heart attack, and that was the reason for his cardiac arrest. So after stabilization and intubation, we transferred him to the catheterization laboratory, and there with the help of our interventional cardiologist, we did angioplasty on the artery which was blocked. And after angioplasty, The patient was better stabilized, and then we transferred him to the CCU for the post-critical care. He was staying in the hospital for 6 days, where he received all the necessary management and medical therapy and post-care resuscitation. And after 6 days, he was discharged from the hospital in a very good and healthy situation. So what I want to mention about the acute coronary syndrome or heart attack, we have to take it serious, and the acute coronary syndrome is the #1 killer in the world. So please check your heart, come immediately to the hospital if you have chest pain or difficulty in breathing or some serious palpitations, severe palpitations, come immediately to the hospital.
I'm Dr. Mohammed Gamal. I'm the head of the ICU department in Emirates Hospital Jumeirah. We received patient Omar in the ICU after having a cardiac arrest in the ER due to acute coronary syndrome, and after doing the revascularization in the cath lab. The most important thing that we were afraid is the post-cardiac arrest syndrome, which can carry multiple organ failure. And the most important is the brain, due to the period that the organs suffer ischemia and then sudden reperfusion. So our job in the ICU is mainly to do the post-cardiac arrest care, which involved the resuscitation of the patient with IV fluid to keep his blood pressure at a normal level, to keep his temperature on the lower side, and to keep his sugar in the normal range. We followed up his organs, the kidneys and the liver. We found that they started already having some injury, and that was treated later. We put the patient on the mechanical ventilation and sedation for almost 3 days till all the organs returned back to normal. Then we started to wean off the sedation gradually and give the patient spontaneous breathing trial that was successful. After that, we removed the ventilator and the patient was fully conscious with spontaneous breathing, and that was great.